fact that we lose at least 400 physicians a year to suicide, and mind you, those figures are pre-pandemic and to the US only, though that this is not an epidemic that plagues the United States solely. And then I started to look at why. And I guess I saw the world through rose-colored glasses, and this really brought forth the underbelly of a very fragmented and sick system.
Welcome to the Physician Growth Accelerator podcast, a show where we break down your private medical practice systems into vitals, give you the tools to diagnose root cause of what may be restricting your growth, and prescribe what to do about it. I'm your host, Zed Williamson, and I believe that everything we experience, everything, is the perfect outcome of our current system. So if we want something different, we need to take responsibility and tweak the system. And I'm really excited because today I have a special guest for the podcast, Dr. Sapna Shah-Haque, a practicing internist, and she is the host of the Worthy Physician podcast. Thank you so much for joining us today.
Thank you for allowing me to be here.
Absolutely. So the podcast, the Worthy Physician podcast, I have a podcast, so I know the time, effort, the what it takes to continue to put out episodes. There has to be a drive, something that is basically the spark for why this is important to you. So I'm curious, would you mind just kind of giving us some foundational understanding of where you're coming from? Why was this important for you to do?
Absolutely. That's a great question. I love talking about it. I've been through burnout twice myself. And during the pandemic, it really seemed to be brought forward. But the backstory behind the Worthy Physician is unfortunately a painful one. More painful than my own burnout was I lost my best friend, who is also a physician, to suicide. And in her note, she had denied true suicidal ideation. She had not sought professional help because of the fear of the stigma, and also she was very worried about professional repercussions. And so I didn't know what to do with that grief and the loss. And when hours were declining in clinical medicine at the height of the pandemic, I decided to start a podcast to really dive into what does this mean? Why is this happening in such a beautiful profession? And the stats that I uncovered or that I started to read about were very alarming. The fact that we lose at least 400 physicians a year to suicide, and mind you, those figures are pre-pandemic and to the US only, though that this is not an epidemic that plagues the United States solely. And then I started to look at why. And I guess I saw the world through rose-colored glasses, and this really brought forth the underbelly of a very fragmented and sick system that was worsened by COVID. And I just had words to describe what I had gone through, what other physicians have gone through, and unfortunately, what plagued Dr. Bicker. And so it became a passion project, if you will. And 3 years into it, and I still love talking to other physicians, hearing their stories, bringing on other guests to also answer some questions that we're not taught in medical school, right? Like how to talk to the C-suite. What does it actually mean on some of the business aspects? Why is it important for revenue cycle, et cetera?
Wow, that's a powerful origin story and such an important conversation to get out into the public. The physicians tend to see a lot of patients, obviously. And one thing that I think physicians are very aware of is that patients rarely see you when they should. They see you a lot later. And it's because there's many aspects of our brain and bias and heuristics that allow us to basically ignore the creeping in misery that can happen as a patient, and that's why people see patients farther deeper into their disease state, or there was maybe even some bias against the idea of treatment. And I think very rarely do physicians ever look at themselves that way, and it feels like that's what you're describing with your friend is, imagine the idea of a bias or a belief of potential implications and the path that they were going down, and it was fading into this without a true awareness. Am I off base making that connection?
No, I don't think so, not at all. And especially, again, going back to the pandemic, I know we're a couple of years past it, but it really made a big impact. The wait times, the oh well, I can hop on the computer and Google my symptoms and I can self-manage. But then also, I think the expense, we have to remember that regardless of whether it's preventive care, there's still a lot of times a copay. There's still medication cost, and when you're strapped, or if you're a single parent, or if you're a working member of society, it's very hard to get into office hours because the office hours, right? They don't always coincide with the days that we have off, or it's just hard to navigate that part of being an adult. And it's always, well, put it on the back burner, or, I feel fine today, so I'm going to ignore it. And that's not that's not all the components, but those are some. And to my gosh, well, what if I do have a chronic illness? What does that mean for me?
Mhm.
So sometimes ignorance is bliss, but then acknowledging also, I think, puts us in touch with the fact that we are human and that we are finite.
Do you find in your conversations over the last 3 years, I'll kind of take my position, and please push against it. The term burnout uh, sometimes sometimes goes undefined, and I personally don't believe that burnout comes from your job is to dig a hole, and the hole is constantly getting deeper, and you realize that you're achieving your goal. I think digging that hole can be very hard, but in that instance you don't really burn out. Where you burn out in is it's your job to dig the hole, but you're on the beach next to the water, so every scoop of sand gets instantly replaced, and you feel like the effort you're putting into isn't necessarily achieving anything towards what was originally important to you. It, would you say in your discussions with people over the last 3 years and kind of going down this path with this podcast and your content, is that accurate from what you've witnessed? Am I missing something there?
In the sense that, we all go into medicine wanting to make an impact, a positive impact, to heal people, to be there in the most vulnerable times. And that's not the hard part. The hard part is working within a system that really rewards profitability over, I would say, the humanitarian side, in a sense that, I love medicine. I love talking about diabetes, high blood pressure, preventive medicine, all those things. Those aren't the hard conversations. The hard conversations are having why we can't do a medical test that is indicated, or a medication that is first line because of cost, right? So there's the clinical answer, then there's the insurance answer. Then there's also compounded of the lack of staffing. I think most places, there's a lack of staffing. They're always running short. There are more patients that need to be seen than what spots are available. So there's that. I want to do my best, but that does not mean that I can meet everybody's needs in real time. But there's always a way to try to triage things, or, next day, sick visit. Unfortunately, in rural health, there's not a lot of net clinics. So it's a lot of, well, if you can't wait, then you need to go to the ER. It's not the best use of the system. And then you compound that with many things that if I don't give an answer or a medication, that perspective is this is what I need, but what is perceived as being needed does actually not meet the standard of care, and there's a disconnect. You know, if I get a negative review or if I get pushback, I can't do anything to counteract that. So there's a lot of perceived, um, I would say, the goal versus what actually is the standard of care, if you will. And that's
Yeah.
not something that the patient always understands.
Mm.
And then remember, most of us don't go into medicine for the money. There are easier ways to make money with less liability, with less debt, and with
Yeah.
not so much as schooling. So you compound the fact that insurance is cutting reimbursement along with other things. It's compounding. So going through the medical system as far as training, besides the culture, which we won't even get into, that can add to the aspect of burnout and moral injury because of the culture can be malignant. But when you get out into the system, the way that you've trained is completely disconnected from the way real medicine works. So I think it's multifactorial.
Yeah, that's a really interesting point what you just made. You have reimbursements going down while costs are going up. You have to spend time to fight for the things that just aren't automatically allowed, which is what you likely believe is the most important for you to uncover about the patient. And then that time fighting for it is taking away from other patients. And so that mental argument between, do I just try to go faster in case because I'd hate to not catch something because the first available appointment is in 6 weeks. I mean, there's so many things there that it's like a death by a thousand cuts. There's all these little nicks that are happening. And then that last point you made, that all this training exists in a false reality, that when you actually start to see patients after training, it doesn't represent what you've been through. That's really fascinating.
Yeah, so I mean, it's like RVUs. We had a little bit of discussion about that in residency, but it really wasn't until coming out into practice where I thought and where I learned what that really means. And I had an internist when I was a pre-med student that said, you're going to learn the most during your first year of residency and your first year of practice. And I totally get what they were discussing, like hindsight, because the first year is the medicine's not an issue. It's translatable from one clinical exam room to another, but it's okay, now it's real. And now the coding matters. Now my note matters more so. Not that it didn't before, but I was focusing on the art of medicine, and now I have to focus on both. And so it's something that I try to relate to my medical students that rotate with me and the residents I worked with in the past. But yeah, it's a different beast.
What, for the people out there right now that they're listening and maybe they are trying to talk themselves out of thinking that they are experiencing burnout. They know that they're busy. They know that they are running an uphill battle. From the experience you have and the episodes you've recorded and the people you've talked to, what are some pointers to give people out there who are on that? I don't know if this is burnout or not. I'm feeling these things. What would you have that person do?
First of all, acknowledge it. I think acknowledging what you're feeling is the first step. because it's very easy to say, I'm just overworked or I'm tired or I had a long shift. Oh, it's been a long month. But really reflect and think about it, break it down. And creating that white space is probably going to be the hardest because, not only are we busy with career, but also personal life. But I think it'd be worth the effort to set aside some time, whether it's 30 minutes, an hour, 2 hours, an afternoon, whatever you decide that you need. And it doesn't have to be done all at once, but make it 30 minutes a week at a time. But really honor what you're feeling and try to get down to, okay, what am I feeling? What has changed? And the second thing is if you need help teasing this out, or if you find that you might be on the brink of burnout or having some signs or symptoms, which can be very vague, and it's just a change in your baseline, even at that much more irritability, insomnia, hypersomnia, reach out, whether that's to a friend, a colleague, therapy, a life coach. All those things are definitely great tools, but first step is to honor what you're feeling, set down some white space, and trying to figure out what in the world's going on.
Yeah, it's a lot of the work that we do is focuses on the neuroscience behind human behavior. And I think what you say is so important because here's one of the challenges is if I am undernourished and I am not getting good sleep, that already puts my brain and my mind in a place that's going to make different decisions with the exact same scenario compared to if I was very well nourished and I had amazing sleep. And so if you add stress, whether it's mental or physical, on top of that, you just keep stacking these things, and our brains want to survive. I mean, that's the bias that we have, and it our brains don't necessarily make super good decisions based on second and third order consequences. Our bias is around that first order consequence. And so you, if you're not eating well, you're not sleeping, you're under stress, maybe you're under physical stress as well, your brain is making decisions it thinks is helping you, but it's really just that first order consequence. And the second and third order consequences are the ones that are stacking up in the background. And then by the time that they really let loose, you're in a much worse spot than if you had been processing through it through the entire time. So I think the idea of setting time aside and talking to people is, it's key. We talk ourselves into thinking that, wow, this must not be happening with anyone else, or this would be too awkward to bring up. Um, but it's, sometimes this stings a bit. But if something isn't life-threatening, it's really only ego-threatening. And so if you're concerned about bringing something up, just challenge yourself on that. Like, okay, what is it about this that makes me not want to bring it up? I don't know if you have any thoughts on those statements.
Yeah, I think a few things. Those are all great points, about making good decisions versus better decisions given the situation. I think a lot of times in medicine, though, at least the culture has been, and it's slowly changing, but not fast enough to keep up with what's going on in medicine and in those in the and that is in the culture of medicine, like we're supposed to have all the answers at any given point in time, and that's
Mm-hmm.
just not true. Like that's not
Mm-hmm.
reality. There's a difference why, I mean, there's a reason why there are multiple specialties and even subspecialties. So that's the first thing. The second thing is that if you say that you are having an issue, what would it do to your image? It's not in some circles it's not necessarily professional to ask questions or to be vulnerable. But I would say that there's actually a lot of strength in the vulnerability. And let's frame it this way. If you're starting a practice or if you're starting a business, you're going to ask others that have done it before you for advice or maybe a key pain point that you need reference points on or you need
Mm-hmm.
input on. So it's no different. And it doesn't mean that you have to talk about your concerns to everybody, but a trusted colleague is key. Like that tribe mentality of these are my people, these are my colleagues, so there does need to be I'm not trying to rub anybody the wrong way, but there has to be that safe space that what you say is not going to leave the room or that
Sure.
individual. And if there is not that place within your physical location or practice or your community, there are resources online such as Physicians Code Support, Physicians Anonymous, um, and even other physicians that are life coaches. So those are all very safe spaces and that are accessible.
Yeah, that's really good. Um, you're so right. There's times where we quickly will ask to check our perspective, like you said, in starting a practice, and it's just that's all you have to do is every once in a while there's probably the time to find the right person to check your perspective with. Um, this has been it's a powerful topic. I hope we um, helped light some activity or thoughts in the people who are listening and things that they can do. And if they want to learn more, your podcast is called the Worthy Physician Podcast, and they can visit theworthyphysician.com. And I think you had mentioned before we started recording, you had mentioned that there are some free resources there. What can they find on theworthyphysician.com?
Sure. So there are things that I've used in my own life as a physician, as a family member, as a mom. I try to look at what one of the first guests I had was a physiopsychologist, and we talked about the physiology of burnout, and he brought up a very good perspective of trying to get what are the boxes, right? So spiritual, social, play, work, family, and I put it basically all in a quick journal that is downloadable, and I call it the battle of the boxes. Another one is called Thought Jot. Is just like uh, a quick journal that it's a PDF, you can download it, print it off, but it's just the ability to kind of quickly jot down your thoughts. Why? Because yeah, work-life balance, it's an ongoing thing. It's fluid, it's not anything that's set in stone, but I try to
Right.
check in with myself. And so I found that those tools were helpful. And I can't always remember or rely on my mind with everything flying through there. So organizing my thoughts are is always very, very helpful.
Absolutely. Well, we will put a link to that website for easy access for the listeners. And also, listeners, if you are feeling like there's constraint within your practice and maybe some of that constraint is feeling like burnout, you can also go to physiciangrowthaccelerator.com and check your vitals. It might help you identify where there is the tightest pinch point within your practice that may be causing some of that feeling. Dr. Sapna Shah-Haque, I really appreciate you joining us. It's been a great episode.
Thank you very much. It's been a great conversation.
Absolutely. And we'll see you guys next time on the Physician Growth Accelerator.